So again, my name's Jody Joplin, and I work for Allscripts, and we're going to go through the MyWay demo for Pediatrics. And again, I'm going to just mute your phone lines once we get started. And if you aren't currently in contact with anybody from Allscripts, with an account executive or an Allscripts partner, this is the phone number that you can contact after this demo if you have any further questions or if you want some further details so that we can connect you with an Allscripts partner. This is the 800 number, 334-8534, and just select option 1. What you can expect as we get started in this demo is 3 key values of MyWay EMR, is the ease of customization, the ease of navigation, adaptive learning. It's very, very easy to chart and to navigate through MyWay, and you're going to see that as we go through the demo. We're going to go through a documentation of an encounter for otitis media. And I'm going to show you the end result of a chart note that we're going to build today during the demo, and then at the end we'll go through Q&A, so whatever questions that you have that I can answer. And then what not to expect during this demo. What we won't go through, just because your time is so valuable, is front desk scheduling and patient demographics, and then billing. If you have specific billing needs or questions, we do have specific billing demos scheduled. If you need that information, I'm happy to provide that information to you. And then if you have any specific contract-related questions or pricing questions, again, we won't be going over that through this demo, but again, I can connect you with folks that can answer that question for you. And so let me show you an end result of the note that we'll be creating today for Sally Childs.
Hello?
Hi.
Hi, this is for Dr. Malik.
Okay, yeah, we just started with going over just some highlights of what we'll be doing for the demo today.
Okay.
So welcome. So this note right here is for Sally Child. So this is what we're going to have as an end result of documenting an otitis media visit. So the chief complaint, current medications that the patient is taking, a review of the past medical history, review of systems, as well as the current vital signs for this visit, a comprehensive physical exam. You can see that information there. And again, it doesn't have to be this detailed. It's all up to you and how you document and how you want MyWay to work for your practice, as well as the diagnosis for today's visit, any medications that would be prescribed, services performed within the office, as well as the plan. When do we want the patient to return to the office, and if there was any educational information given to the patient, and then the doctor's signature for this chart note. So that's just a little bit of what we will be going over for today's visit. And we'll begin by starting in MyWay. So any questions as we get started? I'm going to get ready to mute the phone lines, and we'll get started with the demo. And then I'll unmute the phone lines, and you can ask some questions. Okay, if there aren't any questions, I'm just going to mute the phone lines, and then I'll unmute you.
I do have one question on the message center.
Uh-huh.
What are all these labs, refill, phone? Are there other options besides those 6?
Oh, of course, yes. This is all up to creating what you want to see as categories in your message center.
And the screen is based on per workstation, right?
Right. Mm-hmm.
Okay.
That is true. And so I'm going to get ready to orient everybody to the screen. And then when we get it done at the end, if you have any questions as I'm going through the demo, be sure to jot those down, and I'll make sure to answer those at the end.
Okay.
Okay?
Gotcha.
Okay, everybody good? Okay, and again, remember, if you have anything like you can't see the screen, you have a chat area in your GoToWebinar area, so just type that in for me, and I'll keep an eye on that area as well. All right, here we go.
All participants in your conference are now muted and in the listen-only mode.
Okay, so let me first orient you to what you're seeing right here on your screen. This is the Allscripts MyWay desktop. And so each user, whenever they log into MyWay, has the ability to create their own desktop and how they want the information presented to them based on them being most efficient during the day and based on what their role is within the practice. So currently I'm logged in as Dr. Mark Childs. And what I see over here on the far left-hand side are my appointments for today. Over here on the right-hand side, top screen, I have my message center. Now the message center can be customized to be how I want to view my information. So you'll see here that I have different categories of information. Again, completely customizable based on that user and how I want the information presented to me. So this is a quick and easy way for me to see all of my lab messages, and if I have any that are urgent, any abnormal labs, any that are routine or low priority. And I can see that at a glance in one central location. So quickly I could see any abnormal labs and go ahead and review those and respond or send those to my nurse to follow up with the patient as appropriate. Prescription refill request. Again, urgent messages. So at a glance, I can see any urgent messages that I need to quickly respond to. So think about that in a paper world to where I might have charts on my desk. I might have charts in a nurse's station that I'm at. I might have charts in another area that I need to review. This allows me to automate that process and have that in one central location to where I can quickly see all of those urgent or high priority information that I need to respond to quickly. And I can see that all. So if I select my labs, I see all of that lab information, and I can review those all at one time and respond to those as appropriate. Down in the lower section, I have my incomplete notes. So again, based on charts, if you think of a paper world, I have charts on my desk, I might have charts in a lab station, I might have charts in my nurse's area, maybe even in a transcription room or another area of my office. So I have one consolidated area to where I have my incomplete notes that this is information that I need to review and complete and sign off on. If I have a mid-level provider in my practice, I could also see, and I can even divide between my notes and my mid-level notes and see those notes that I need to review and sign off on for my mid-level providers. So again, automating those workflow processes and making it very easy for me to see that information in one area. So if we take a look at the patients that have appointments for today, we're going to be looking at Sally Child. So I see the patient has an appointment for a sick visit for ear pain. So what happens is the patient presents in the office, and the front desk selects the time link and checks in the patient's appointment, or checks the patient in. What the nurse does is indicates the patient is ready for the provider. So on my desktop, I would see the patient is ready for doctor, which indicates to me that the patient's ready for me to go into the room. But before I do that, I would like to familiarize myself with the patient before I go into the room. I like to review past notes, past medical information. I can do that by selecting the one-page summary. The one-page summary takes me into an area that I can review past current medication, active problems, chart notes, maybe any results from any labs that we might have done. I can review all this information, and this is completely customizable based on how I want this information presented to me. So in other words, the one-page summary is completely up to me how I want to see this information. Now, you'll see here that I have my visit note 438, so for today's visit, so I can quickly familiarize myself with what my nurse has already documented for me. I see here the patient's here for an ear infection. The review system shows the patient has had a fever, has had some complaints of otitis media, hasn't had any hearing loss or any nasal discharge, post-nasal drip, sinus congestion, or a sore throat. We see the vital signs information. We reviewed the medical history and current medications that the patient has been on. So you see quickly at a glance I can familiarize myself with the patient. I also have a photo of the patient before I go into the room. So once I've reviewed that information, I can also review any attachments, so anything that's been scanned in and attached to the patient's chart. I can go ahead and now go into the documentation for today's visit. Once I'm in the documentation, you'll notice at the top of my screen, I see the vitals information that has been documented for today's date of service. Now you'll notice here I see ear infection. And I'm sure you're wondering, okay, ear infection, what does that even mean? One of the great benefits of MyWay and a value to you as a provider is that because this is not a template-based system, whenever your nurse gathers the chief complaint information and documents it, it presents to you on the history of present illness clinically relevant terms based on why the patient is in your office today. So when the nurse documented chief complaint, immediately when you open the chart note, you're on the history of present illness area, and you know the patient is here for an ear infection. You also see the vitals information, so you don't have to go back to the vitals tab unless you need to take another vitals entry. You'll see here that ear infection, because it's template-based and I work from left to right, I can start anywhere and I can go anywhere, which means I can start my documentation anywhere that I want on the screen. You'll see I have categories, so location. Is it on both sides? Is it on the left? Is it on the right? So you document based on what is the patient's complaint. So it is on both sides. It's acute. It's constant. It's sharp pain, and it's worsening. It was sudden in onset. What was the onset of symptoms? It started about 5 days ago. The severity is moderate. What is the frequency of these episodes? It's been happening monthly. Patient has had otitis media in the past 30 days. Is there any triggers? Position change and weather change we've noticed. Is there any alleviating factors? Medication. Exacerbating factors? Position change and medication. Pertinent negatives and pertinent positives. Great thing about this is that as you're asking the questions of pertinent negatives and pertinent positives, you can document them at the same time. Does Sally have a cough? No cough. Any decreased oral intake? No. Difficulty sleeping? Yep, a little bit of difficulty sleeping. Ear pressure? Yes. Any fever? Has had a little bit of a fever. Has the patient had a headache? Seemed to have a headache. No headache. Irritability? Has been a little irritable. Have you noticed that Sally's had a sore throat or anything? No, no sore throat. Any vomiting? No vomiting either. So you'll notice the ease of use to where you can document negatives and positives all at the same time, and you can start anywhere, go anywhere. Were there any significant medications? Is the patient on any antibiotics? No antibiotics. Okay. Now, because the nurse has already documented the history, unless you need to review the history or make any changes, no need to review that information. Review of systems has already been documented by the nurse, so no need to review that information. The provider can move right along to the physical exam. Because you, as the provider, have the ability to set up and customize what your within normal limits documentation would be, you have the ability to select a check all or select all to where it will document all of these systems of what your normal within normal limits exam is. And then you can document by exception. So then we move down to the ears, nose, and throat area. We document on the otoscopic exam that the left tympanic membrane is not a normal exam. However, it is bulging. So once you document that, everything else is normal. However, in that one area, that is the positive finding. And you'll notate that that is in the bold text. If there's anything else that is abnormal, you can document that by exception as well. You also have the ability to free text type. You can use your stylus, which will convert it to text. And you can also use Dragon, which will convert voice to text. So now that we've done our physical exam, we can now diagnose the patient. You'll see here that we have a frequently used diagnosis area. Now what this means to you as a provider is that because MyWay learns how you practice medicine, MyWay will remember your top 50 diagnoses and build that list for you. And not only that, it's going to remember what your top 50 and the order in which they are and present those to you. And what that means to you as a provider is it will remember the most frequently used and change that list for you. So for those seasonal changes, for example, when patients come in for a physical exam, so it's that time of year where you're doing your school physicals, or you have the allergy time, the allergy season, or you have flu season, it's going to remember, MyWay will present to you your most frequently used list in the order in which you use them the most frequently. So this list will be changing for you based on how frequently you use that diagnosis. You also have a Sally Childs list. So that is the patient-specific diagnosis list, so what the patient has been assessed with in the past. And then you can also have specific categories, which is based on your super bill. If you would like to build out categories just like your super bill has on it today, that can be built the same exact way to where that's formatted the same way in MyWay. So if we assess the patient with otitis media, you'll notice that that diagnosis code displays on the left-hand side. What that means to you as a provider is that MyWay offers adaptive learning, and the value to you as a provider is that as you document a diagnosis code, MyWay learns your treatment patterns, and it will then present it to you again for any patient that comes in for that same diagnosis code. So in other words, any patient that's come in for a 382.00 for otitis media, whatever treatments that you have done in the past, medications you prescribed, services that you've performed in the office, services that you've ordered to an external facility, and then your plan and instructions. So when do you want them to return to the office? MyWay offers adaptive learning and will present that treatment plan to you so that all you have to do as a provider is select all. This is your interaction warning. What that does is we'll give you a contraindication warning if there's duplicate therapy, if there's any allergy interactions that you should not be prescribing this medication. So it will prescribe this medication. It will show service performed in the office. If you've ordered anything at an external facility, it will show you that as well. And then when should the patient return to the office? So what are your return instructions? You also have the ability to select the single options that you want as well. So if I wanted the patient to be prescribed this medication, again, this is my duplicate therapy warning or my contraindications warning. If I want the patient to return to the office in 10 days, I can single select the pieces out of my treatment plan that I want to prescribe or I want to treat the patient as well. If there's something outside of this treatment plan that I want to do for this patient, I can also do that. So if there's a different medication I'd like to prescribe, I would just simply go to the RX tab and I can prescribe that medication. MyWay will then remember that medication that I prescribed for this diagnosis, and it will add it to my treatment plan and then present it the next time a patient comes in. So MyWay learns how you as the provider practice medicine, and it will remember your treatment plan and present it to you every time thereafter. So essentially, from the Diagnosis tab, it will document the remainder of these tabs for you based on what you've selected from this diagnosis area. So I've now prescribed my medication. This will go electronically to this pharmacy. So this is the preferred pharmacy for this patient. I didn't select a service performed within the office. We didn't order anything for an external facility, but we did indicate that we want the patient to return in 10 days to the office. If I need to refer the patient, let's say the patient has had otitis media several times, so if I need to refer the patient to an ENT, I can refer the patient here. If there are any additional patient instructions that I want to give, I can put that here so I can free text type. Again, I can do my stylus and convert to text, or I can use Dragon. If there's any overall visit notes, I can put that here, or any internal notes just specific for our office. I can indicate that here. I also have education forms. So because I chose a specific diagnosis code, that diagnosis code has attached to it ear infection otitis media educational forms, which will be printed upon checkout and given to the patient's parent, with some educational information, signs and symptoms to watch for, things that can cause otitis media. So just some educational material that can be given to the parent. I can also remove that if I did not want that to be printed and given to the patient. In addition, if there are any attachments that I would like to do, so I have the ability to attach an item. So if I wanted to import maybe an existing image, so let's say if there's something for the ear that I wanted to import, I can do that from here. You have the ability to import any or all of these, or if there's something specific that you want to import, you have the ability to draw on the screen, and you can attach this to the patient's chart. So again, all of these diagram images are within MyWay, so you have the ability to use what's already there, or if you have some diagram images that you like to use internally within your practice, that certainly can be imported within MyWay, and you can use that as well. You also have the growth charts. So your growth charts are plotted and graphed based on when the vitals are entered and attached to the patient's chart. As you hover your mouse over them, it gives you the details about the vitals. And of course, you also have the immunization information. So you have all your immunizations and your vaccination record. You also have that on the history section to where you can easily see that information for their immunizations. At this point, when the provider is done documenting the encounter, they would save the note. All the provider has to do at this point is complete the note. And when you complete the note, that is actually adding your signature onto the note, and that will sign the note and complete it. This is an indicator and a safety for you. So what this does for you as a provider is indicates that an E&M code has not been chosen. So if you want to go ahead and select an E&M code and you choose yes, you're going to see displayed that an evaluation and management screen is going to come up to display for you the E&M code. Now what this does for you is that as you document in MyWay, one of the great benefits of MyWay is that it is calculating on each one of these tabs the points towards your E&M code. So if there's any area or any section that you want to review, you can simply select that area. It will take you back to the review of systems. That's what I selected. And what happens is when you go back to the review of systems, you can review that documentation, make the modifications as needed, and then go back to the E&M and review the calculation. So in MyWay, because it's calculating for each tab the level towards the E&M code, you have the ability to review that information before you say, yes, it was low complexity, and you agree with the 99214 level of care that it calculated. This is coding with confidence in MyWay because you know, based on your documentation, it supports the level of E&M code that you're billing out for. When I say OK to that, it is now calculated my 99214, and now I can sign off on my chart note. So once I select Complete Note and select OK to that, this is showing me that it's going to print the medication because I am not actually connected to an electronic network. If I was, it would go ahead and go electronically. And now I have signed off on my chart note. So now back at my desktop, you'll see it shows ready to discharge. So that's the indicator to the front desk that the patient is ready to check out. They get a closed door icon to where they can select that, attach the copay so they can collect the copay amount, print out any patient plan that the provider has indicated, a prescription if it didn't go electronically or it could not go electronically, education forms that the provider has indicated needs to be printed. If the parent would like a patient visit receipt for the copay, can print that. And if they would like a copy of the super bill, they can print by a single selection all of those forms. And then you'll see here that the provider has indicated we need to schedule a return appointment in 10 days. So the great thing about MyWay is usually lost in translation between the time the patient leaves the exam room and gets to check out is, did the provider indicate you need to return in a specific amount of time? The provider has indicated 10 days. We have a 10-day link. It will search to go out 10 days. You can search either for all free time or you can open it up and search for a specific type of appointment. Perhaps it's a follow-up. Search for that specific appointment. If Tuesday works best for that parent, go ahead and schedule that appointment. Select OK. And now we've scheduled the appointment. Now the patient has been discharged and they have checked out. One other thing I'd like to point out real quickly to you is the ability to use what we call common problem palettes. Now going back into the full note composer, which is where you document your encounters, you have the ability to use a common problem palette. And what does that mean to you as a provider? What that means is when you select this icon to go to the common problem palette, you can document those quick visits or even those chronic visits. You'll see here that I have several different types of visits that I can choose from. So if we have a visit, let's say it is a tonsillitis visit or even an otitis media visit, you also have your well child visits. This allows you to quickly document a specific type of visit. So you'll see here I have otitis media. And what happens here is that I can document all of these different areas of my visit by using this single selection on the far right-hand side where it says Select All. And it will document all those areas of my chart node. If perhaps it's tonsillitis, these are all the specific areas I can document. Maybe those are the common things that patients typically come in complaining of, and it will document all those areas. It's very easy to customize. If there's something that I want to change about a common problem palette, you'll see these are all of the areas that I can quickly document for a common problem palette. So if a patient comes in for a chief complaint, a sore throat, I can document and default sore throat, my history of present illness, my physical exam, the diagnosis, the prescriptions that I would prescribe, services performed in the office, services I would order in an external facility, if there's any default visit notes or patient instructions, if I would typically like them to return to the office within a specific amount of time, any exercise or diet restrictions or instructions, I can default all of that information to quickly document my chart node and then modify it as I need to based on that visit for that patient. We refer to that as a common problem palette. So again, all I would have to do is do my Select All. It will document all of these areas to where all I do is select OK. And now it has documented a sore throat, my history of present illness items, and then I can modify as I need to. History would be specific for that patient, so I would just modify as I need to. You'll see the diagnosis has been documented as acute tonsillitis. If there's a prescription I would typically prescribe, I can default that. So your common problem palette is a way to quickly document those same type of visits that you see most commonly and then modify as you need to based on that specific visit.